Magandang araw, Podmates! Our guest today is Professor Fatima Gaw, an accomplished digital media researcher at UP Diliman's Department of Communication Research. She has been studying the spread of fake news, especially in the context of Philippine politics and history. Magandang araw sa iyo, Fatima, and welcome to my podcast.
Magandang araw sa lahat.
I was reading some of your articles na lumabas sa popular media. Sa internet. And at the beginning of the pandemic, you wrote that fake news is like a virus. Please explain, no? Why did you compare fake news to a virus at particularly a crucial time nung kumakalat pa lang yung pandemic?
So, we know in other parts of the world, especially in the US, there are a lot of movements that are spreading misinformation in the context of health. In an ideal world, COVID would definitely not easy, but could be addressed more efficiently if people are more receptive to scientific information and listening to experts and scientists and doctors. But because there's this other problem that the World Health Organization actually acknowledged as infodemic, there's that, it's a bundle of problems. There's a pandemic, the virus is spreading. There's also the virus of false information spreading. And I think why it's called the virus, I guess why I use the metaphor of a virus to describe this information as a crisis, is because it's really social in nature. Because there are people you trust, even if they don't have the expertise or the credentials to claim, I can talk about COVID vaccines, for instance, even if I'm not a doctor, but I trust this person. There's that dynamic of, I believe not necessarily in the institutional authority of this person, but because of our social relationship. That's why when you're surrounded by people who are more susceptible to this information, more likely you will be more open because you trust these people. So iba na yung konsepto or I guess notion natin ng trust nowadays, especially because there's also a lot of anti-establishment rhetoric happening. We know that there's a lot of anti-media populist rhetoric being thrown around by the state, by other actors. There's anti-science promoters out there. So in the context where there's heightened distrust of institution, where do you seek information? It's in the alternative sources, which are not people who can really vouch for this information, but they are out there and are quite popular, in fact, because of that social capital they have online.
Well, of course, many of us noticed a lot of the falsehoods about COVID that went around, partly because there was a vacuum then, no? Especially early on in reliable information, and even scientists didn't really know much about it. No? But something happened that kind of gives me a little bit of hope, no? Na pwede pa rin makorek yung mga kumakalat na falsehood. No? Kasi early on, there was a lot of anti-vax disinformation, falsehoods, magiging zombie ka kung magpabakuna, etc. And, the early surveys on vaccination showed that a very low acceptance rate, no, or very few people, or low percentage of people who were surveyed said that they would allow themselves to be vaccinated, no? May mga figures ako nakita, mga 20% early on, no? Or much less than half, those surveyed. But now, at least yung mga nakikita ko rito na figures pertaining to Metro Manila, I mean, the vast majority have been vaccinated. In other words, na-overcome din itong this ecosystem of disinformation na kumakalat, yung mga conspiracy theories about vaccines. In other words, there were other factors that made people accept vaccination, and
Correct.
partly that's partly the reason why we're able to circulate a lot more now, and fewer people are dying, fewer people are getting infected kasi nga ang dami nang nagpabakuna.
I think in general, in an environment with high certainty, there is more susceptibility to this information. As we know more about the virus, as we know more about the solutions to viruses, especially with the public policy abroad, what's effective, lockdown ba, or vaccination, a combination of that. We learn more. There's more certainty to the end of the tunnel, how we can solve this pandemic, and we know that it's vaccination. So that happened. No? There's more certainty. There's more vouching from experts, even from ordinary people who have vaccinated themselves, and then you see that online, then you are encouraged to do so. That's the thing. This information is responsive to the dynamics of the environment as well. In the context of health, where certain information or scientific proof can be given, that perhaps is something that can hinder the spread of this information. Definitely, meron pa rin mga anti-vaxxers, pero hindi naman sila ganun magiging ka-resonant if they're not there's evidence in media and there's social movement already to support vaccination.
So, masasabi mo bang isa tayo sa mga nangunguna rin dito sa pagkalat o yung pag-pioneer ng mga techniques, technologies pagdating sa disinformation?
Mm-hmm. A lot of reports actually label the Philippines as patient zero of this information crisis globally, and whatever the strategies and tactics executed in the U.S. elections, Brexit campaign, nauna na yan sa Pilipinas. Parang ito yung experimentation, tayo ang guinea pig ng disinformation operations. I think we need to say this outright. The solution to this is multifaceted. It's not just the journalists doing fact-checking. It's not just the civil society doing media literacy campaigns. So unahin ko na yung fact-checking kasi yun yung parang top-of-mind solution. Fact-checking works because they create sources or actually references na may mga information yung mali out there. So kung gusto mo malaman as a student or as an individual na totoo kaya to, I can just Google at na-check na pala ng Verifile. So okay na yan, na-fact check na yan, I believe that.
Hi, I'm Howie Severino. Check out the Howie Severino Podcast, an original for GMA News and Public Affairs. New episodes will stream every Thursday. Listen for free on Spotify, Apple Podcasts, Google Podcasts, and other platforms.